Good morning, everybody. Good morning, and thanks for joining our webinar at this very early hour on a Monday morning. My name is Martin Weber. I'm the team lead for quality of care and the program manager for child and adolescent health in the WHO regional office in Europe. And I have the pleasure of chairing this webinar this morning. We are meeting today for the fourth time under the Health Systems for Early Childhood Development, which is, for those of you who have not been part of it before, a joint initiative of UNICEF, of ISA, the International Step-by-Step Association, and WHO Regional Office for Europe. As there are some technicalities, I would like to share some technical instructions with you. We have translations into Serbian, Bosnian, Croatian, Montenegrin on one channel and on Russian in another channel. If you want to choose one of them, you should click at the translation globe at the bottom of the Zoom window. This is shown in the picture which is shared with you in the interpretation globe. If you have any questions during the webinar, please use the question and answers box, and we will monitor this as it goes, and then we can actually respond, hopefully, to meaningful selected questions as much as we can during this period. We are doing this in multiple sequence in three blocks effectively. We will have first opening remarks by the heads of our representatives of our three agencies. Then we will have a substantial technical discussion afterwards of the pocketbook of primary care for children and adolescents to introduce you how the early childhood development part and especially the monitoring of child development actually works. And we hope that we will do this in a very interactive way, so we count on you. And in the end, we have three country representatives to discuss with you how the last years of early childhood development has affected children's developments and how we can possibly use the content of the pocketbook and its adaptations in a way to remedy the situation. So for the first part, for the introduction, we have got Dr. João Breda, the head of the WHO Office for Quality of Care and Patient Safety in Athens. We have got Alexandra Jovic, the Early Childhood Development Specialist of the UNICEF Regional Office for Europe and Central Asia. And we have Mrs. Liana Gent, the Executive Director of ISA, to open our webinar. And I would like to kick off with my colleague, João Breda, and hand over to you. João, the floor is yours.
Thank you very much. Thank you very much, dear Martin. Hi, everyone. Good morning, particularly for those who have to wake up much earlier than usual today. We are extremely grateful, but of course, for everybody, because I can see that we are gathering here several different time zones in the context of the European region, which is really the nature of our work. So really express our gratitude for all of you for joining today. Congratulate for the initiative, of course. Thank our partners on behalf of WHO and as the head of the Athens Quality of Care Office. We are really grateful for this initiative moving forward, and we are extremely grateful to our partners, in particular UNICEF and ISA, for all the continued support and for really accepting to work together with us. At our end, the only thing we can do is to really express, once again, reiterate our full support to the joint work to ensure that health systems deliver quality of care also, and in particular for our youngest children. This is very important for all of us. We all know that early childhood is indeed a critical period for children to receive nutrition and health care to enable optimal development. It is also as we all know, the best time when preventative and health promotion interventions are more effective and have a long-standing, really durable effect for the remaining of their lifespan. So it's really very important to have these early interventions, and we are not yet performing and implementing them as well as we could be. We all have to acknowledge that. So for us, investing in early childhood development is one of the best investments every country can make. From those who are really wealthy and very advanced countries to others that are lagging a little bit behind and are looking forward to opportunities to leapfrog and to move faster in protecting children and their health and promoting their livelihoods. Therefore, when we talk about early childhood development, we mean the period, as you know, from pregnancy to entry into primary school, with a focus on the development of the child up to 3 years old. We all know that during this stage, the health sector plays a critical role, very important role in the health and well-being of all children. We do not ensure children, if we do not ensure children receive the right care and nutrition at this early stage, it may have, we know it will have, lifelong consequences that cannot be remedied, that cannot be fixed later on. So the earlier we do it, the better. Many of these early consequences, they will not be able to be remedied at all, as we all know. We also acknowledge that most countries, most of our member states in the European region have some systems to support the development of children during early childhood. However, the evidence shows that children with risk factors as well as those with development difficulties are by far identified too late. And more children begin their life at a disadvantage because they do not receive the care that they need for their physical and psychological development. As such, the vision of the WHO Regional Office for Europe, its program of work for 2020-2025, which has this main motto, United Action for Better Health in Europe, leaving no one behind. To achieve that, we must do better to ensure that no children is, in fact, again, left behind. Also, the vision of our Athens Quality of Care and Patient Safety Office builds and is inspired in this European program of work, public health program for the entire European region. So I'm really very glad that today we will focus on the role of primary health care and its actors, providers can play and should play to make this vision a reality. We all know how much PHE is important, and I don't need to go into that detail. And I know I don't have to convince you about the importance of all the tools we can deliver with and through primary health care. For this, our team has recently published the WHO pocketbook, Primary Care for Children and Adolescents, which we hope will support doctors, nurses, and other health professionals to deliver evidence-based and good quality health care to children and adolescents. We are committed to support countries with the adaptation and translation of the pocketbook, and very pleased to announce that Ukrainian and Russian versions are already available, and we are working on other versions, notably on Greek, Armenian, Romanian, Italian, several translations going on, and also adaptations where we are really ready to work with the countries as you see fit better to support you in a more light or a more intensive way, and we are ready to come to the countries and work with the countries in the implementation of this pocketbook. Also, we are working on the development of an app that could eventually facilitate the use of this pocketbook. The pocketbook is for professionals, but it's also very easy to understand, to be understood, and to be used, or at least for the families to be acquainted with it, and also for community workers and really for people working at the local level. It has, as I said, a focus on health promotion and disease prevention, and a very strong focus on early childhood development. We very much hope that we can continue to work together with all of you. In fact, all of you. We would like, by doing that, to ensure that all children, again, reiterating what we said before, across our region, bridging the gap, reducing the inequalities, they receive the care and support they need and deserve to be able to reach their full potential and lead healthy and productive lives. Thank you very much. I wish everyone a great workshop today and very much looking forward to continue to work with you. Over back to Dr. Weber for the continuation. Thank you, Martin. Over to you.
Thank you very much, Joao, for this opening remarks. And as I'm monitoring the chat on the side, I want to say that we are monitoring this in Russian and Serbian as well. So if you put your questions down in your respective languages, we will extract it and put it afterwards. And with this, I would like to hand over to Alexandra Jovic, the Early Childhood Development Specialist at the UNICEF Regional Office for Europe and Central Asia, to give her opening remarks on behalf of UNICEF. Alexandra, please.
Thanks a lot, Martin. Thanks a lot to colleagues from WHO and ISA, and many, many thanks to all of you who have joined the webinar today as a growing community of practice and colleagues that can help really make this vision about early childhood development a reality. The first 3 years of life and the first 6 years of life are really a critical window of opportunity to support every child to develop to their full potential. However, data tells us that 1 in 5 children in Europe and Central Asia are at risk of not developing to their full potential due to lack of nurturing and stimulating care in the family, poverty or social exclusion, or limited access to essential services. Led by our mandate to promote the well-being of every child, last year, UNICEF joined sources and resources with the WHO Regional Office for Europe and the International Step-by-Step Association to strengthen health systems to better support families for optimal child development. Due to their routine and multiple contacts with young children and their families, health systems and health practitioners are powerful platforms to support children's health in a holistic way, going beyond physical health and addressing social, emotional, cognitive, and language aspects of development. At UNICEF, we are deeply committed to enhancing health policies and practice to strengthen support for child development. We support development of tools and guidance for policymakers and health practitioners. We support knowledge sharing and advocacy to make every contact of health professionals with young children and families count for child development and be a point of focus support for nurturing care. Today's webinar is one of the series under our joint Health Systems for ECD, as you heard from Martin, and aims to present concrete approaches for enhancing child development and highlighting developmental monitoring. We believe and advocate that developmental monitoring should follow development of all children, of every child over time, with the participation of caregivers. It entails engaging in conversations with caregivers, parents, about the development of their children, listening to their concerns and needs, and delivering individualized advice and support on how to enhance child development as a part of everyday routine family life. Developmental monitoring includes careful assessment of progress across all developmental domains to ensure early identification of infants and young children who may be at risk of developmental difficulties. And it facilitates, equally importantly, their timely access to adequate support. You all know that if risks or delays are detected early, many developmental difficulties can be prevented, thanks to the high and unique brain plasticity in the early years. And as such, developmental monitoring is the first and the most critical step for effective national early childhood intervention systems. UNICEF has placed very high on the agenda strengthening developmental monitoring within the primary healthcare and building national, family-centered, early childhood intervention systems. And I would like to use the opportunity to reaffirm our readiness to engage and work together with policymakers, practitioners, and partners on these issues to ensure that every child in our region thrives and develops to her and his potential. I'm really excited to hear more about a pocketbook, and I hope that everything that you hear will help you advance your practice and put these new approaches immediately in use. Thank you, and over to you, Martin.
Thank you very much, Alex, for your opening remarks. And you can hear already, you get a consistent pattern of support from the 2 UN agencies. I now hand over to Liana Gent to speak on behalf of ISA and make her opening remarks. Liana, the floor is yours.
Thank you very much, Martin, and a warm welcome to everyone also from ISA. We are really happy that so many of you joined today. I was looking at the chat and it's wonderful to see so many countries represented. From my side, a warm congratulations to our partners from WHO Regional Office for Europe for producing this guide on primary healthcare for children and adolescents, and particularly for the spotlight on the early years. We all embrace the belief that all people everywhere have the right to achieve the highest attainable level of physical and mental health. And the enforcement of this right starts with a very strong primary healthcare system. To make this happen, we must work together to strengthen primary healthcare so that we can support sustainable scaling up of high impact innovations and improve the quality of care that newborns, children, and adolescents deserve. Promoting and monitoring child development are increasingly seen as routine tasks of primary healthcare providers. And in light of this, the pocketbook is a very useful resource for guiding the work of these providers on examining, managing cases, and counseling during these critical developmental stages. Today's webinar, the focus of today's webinar is very relevant. Developmental difficulties in early childhood are often linked to exposure to environmental and psychosocial risk factors, as well as to a range of common preventable conditions. For instance, the lack of responsive caregiving, undernutrition, and so forth. They're also linked to neurodevelopmental disorders, for instance, cerebral palsy or autism. Monitoring children's developmental milestones from the very first year of life is one of the best ways to identify those who need additional support and specialized intervention earlier rather than later. Of course, all parents need support, but some parents need more support than others. This enables primary care providers to coordinate the continued health care of children and adolescents with long-term conditions and diseases managed by specialists. The pocketbook provides relevant guidance on when a patient must be referred to a more specialized level of healthcare. To conclude, a strong health sector, starting with an efficient primary care system, is indispensable to reach the goals of the nurturing care framework in terms of optimal development for every child. We at ISA are delighted to join forces and collaborate with partners from WHO and UNICEF in Europe and with government representatives to fulfill these objectives. Today's webinar, which, as Alexandra said, is one of a series of many, is just a step in this direction, and we're very excited to join forces and to learn together how to support every child from the very first days of life. Thank you very much, and over to you, Martin.
Thank you very much, Liana. I think you can all see already how several agencies are uniting to support early childhood development, and the support is there. Now let's move on to the content. So we will have a very interactive session, so be prepared to be asked questions in between. And this is going to be led by our two main experts who have been driving forwards the pocketbook of primary care for children, Dr. Susanne Caray and Dr. Sophie Julien. They both contributed in a major way to the development of this pocketbook, so they are well prepared to outline to you what's in it and answer questions as it will come forward. So they will highlight how to promote and monitor early childhood development, how to address developmental difficulties during well-child visit, and when parents are coming with particular concerns to the healthcare providers. We are going to do this over the next half hour or so before we move over, as I said, to some country experiences. With this introduction, I would hand over to Susanne Caray to run the show and presentation. Susanne, the floor is yours.
Thank you, Martin. Good morning, good afternoon, and good evening also from my side. If I could have the slides, please. While the slides, thank you. Please, while we are putting off the slides, everyone grab your phones because we will invite you to participate on the Mentimeter to answer some questions and give some feedback. So as said by all the speakers, Sophie and I are going to present the WHO Pocketbook of Primary Health Care for Children and Adolescents to you, with a spotlight on early childhood development and developmental difficulties. I would like to start by thanking, I saw in the chat we have Ilgi and Revan with us. They were two of the major experts working on this part of the pocketbook, so I'm happy you're there. Next slide, please. So as mentioned, please take your mobile phones and go to www.menti.com and enter the code you see on the screen, 54932671. And yes, I see that the first people already start liking the page. So please, everybody do this. So I will wait a moment so that everybody had a chance to join us on the Mentimeter. People still joining? Ten more seconds. My colleagues put the code also in the chat. So if you need some more time, you can see then the instruction also in the chat. Next slide, please. So the WHO European Office has been monitoring what countries in the European region are doing to support early childhood development. And we ran a survey back in 2017 and a repeat last year. And here you see the map with the results, the answers to the questions. Do you have a system in place supporting early childhood development? And you see that very nicely, we have a very green map. So all countries are doing something to support early childhood development. Next slide, please. We would like now from you to know how many children are actually at risk of developmental difficulties in the WHO European region. 500,000, 1 million, or 5 million? Thinking that all countries are already trying to address that. We will wait for like 20 seconds, 30 seconds to give you time to answer the question. I can see clearly in the lead, 5 million, followed closely by 1 million. Less people thinking it's only 500,000. I think it was already mentioned in one of the introductory remarks. I would also like to mention that our pocketbook, because I saw that we have many participants from across the world, the WHO pocketbook we are presenting is actually focused and has been developed with the WHO European region in mind. However, it should be quite easily be adapted also to other contexts and the global context. So we very much encourage that. Okay, so we have 89 people who voted and 90. Okay, I will. So we will now solve this, and I think we talk here to a very informed audience, because indeed 44, the majority of you are correct. There are 5 million children at risk of developmental difficulties in the region. Oh, and now everybody is giving the answer 5 million. Okay, next slide, please. Here you can see that we have a very diverse prevalence of developmental disabilities in children under 5 across the region, but we have a very large number of children that are at risk of developmental difficulties that would really benefit from being identified and supported early on. Next slide, please. So, developmental difficulties, why is this important? So I mean, I'm preaching to the you know, you're all experts, I guess, but yet developmental difficulties in early childhood are significant contributors to morbidity and disability in later life, and we have only a small window to address them. And as we saw, systems for monitoring child development and providing prevention and early identification of risk factors and early interventions, while they are somewhat existent, they are often weak, fragmented, and poorly organized in many countries. Next slide, please. Which leads to the fact that children are identified too late. Now, there are many things countries can and should do with a broader health and all policies approach, but today we are going to focus specifically on the role that primary healthcare providers across the region or the world can play to identify children at risk, provide early interventions, and really help us close this gap or address those needs. So what can and should be done by primary healthcare providers? They should provide well child visits to all children. Each child should be monitored across the first years. They can counsel parents on important issues affecting early childhood development. They can assess and address risk factors. They should monitor developmental milestones, identify children and areas that would benefit from extra support. So that is not all children, but just some of the children will need that. And then they're in the good position to coordinate early interventions with other providers, and also to identify and manage conditions that lead to developmental difficulties, and coordinate with care with specialists if then there is a diagnosis, as mentioned earlier, like cerebral palsy or autism. Next slide, please. So infancy and early childhood are the best times to prevent and respond. And as already pointed out by all the speakers in the opening session, if not supported, children will not reach their full potential. And that is not only bad for the families and the children themselves, but also for the society at large, as they can suffer from high healthcare costs and increased burden of diseases later on. We have prepared a fact sheet you see on the right-hand side. I'm not expecting you to be able to read that, but we will share this and it can be downloaded from the WHO website. Next slide, please. So now the pocketbook. And here you can see it. We are very proud that we have now hard copies as well. You can order them from the WHO bookshop, or you can download copies for free from the links that were shared in the chat. It's available already in English, Russian, and Ukrainian. So While primary healthcare is considered the most inclusive, effective, and efficient approach to promoting the health of everyone, including children and adolescents, often children and adolescents do not receive the care they need. This is true not only for early childhood development, but throughout the years. But particularly there's a lack of health promotion, including breastfeeding support and other important preventive measures. Primary healthcare providers often lack the knowledge and resources to provide the care that is evidence-based and in the best interest of the child. And there were no evidence-based comprehensive primary healthcare guidelines for children and adolescents. So that's why we set out to develop the pocketbook. Next slide, please. I will just briefly share some of the features of the pocketbook. It is based on existing WHO guidelines or other evidence-based guidelines. It is targeted to primary healthcare providers who are responsible for the care of newborns, children, and adolescents, so up to 18 years of age. And it's applicable, as said, across the WHO European region, but it can be easily adapted also to the global context. It is pocket-sized so that healthcare providers can carry it around easily during their daily work. Next slide, please. So the pocketbook supports primary healthcare providers with the diagnosis, treatment, and management of common condition and presenting complaints such as fever and cough and abdominal pain. It helps them how to manage, but also when to refer those children. I already mentioned a very important role of primary healthcare providers is to coordinate with specialists for conditions like diabetes or that are managed usually by specialists, but that the primary healthcare provider should understand and be able to appreciate fully. And for today, that is actually the main part, is the health promotion and disease prevention focus, with information on timing and components of well child visits from the newborn period to adolescence, the promotion of early childhood development, preventive and promotive measures with vaccination, screening tests, and very importantly, also counseling messages geared towards parents on breastfeeding, complementary food, nutrition, but also the prevention of sudden infant death syndrome and sunburns, everything you would like to prevent. Next slide, please. Here you can see the table of content. We have 9 chapters and 10 annexes. It actually got quite thick, but it's still relatively light and can fit in the pocket. So the first 2 chapters focus on providing care from birth through adolescence and diagnostic approaches. Then chapter 3 and 4 focus on well child visits, health promotion, and disease prevention. Chapter 5 is focused on the newborn, so everything that is only specific to the newborn. Chapter 6, which is the biggest part of the book, the core of the book, is the child or adolescent presenting with a specific complaint or symptom. Chapter 7 focuses on diseases and conditions. Chapter 8 focuses on adolescent health. Again, like the newborn, only conditions that are specific to adolescents and will not be relevant for the younger child. And chapter 9 focuses on emergency and trauma. Our annexes are very practical. They range from the organization of care for primary health care level, and we have information on practical procedures, very important drug tables for easy reference. Next slide, please. In this presentation, Sophie and I are going to focus on chapter 3, 4, 6, and 7. As they are the most relevant to the early childhood development, with the well child visit, the health promotion and disease prevention, and then with some specific complaints, symptoms, and disease conditions. And the WHO growth charts are also one of the annexes we will show you in a moment. Next slide. So over to you, Sophie.
Thank you, Suzanne. So after this very nice introduction, and so now you get a very good idea on what is the content of the pocketbook. The core question, let's say, would be, so how does the pocketbook really support the primary healthcare provider with, on the one hand, the promotion of early childhood development, but also on the identification and management of developmental difficulties? So we'll go in the next few minutes with two cases. So we'll have Sarah. So Sarah, she's 6 months old. She's coming to your primary healthcare clinic with her parents for regular well child visit, because she was told that when Sarah was 6 months, she had to come to you for what they say, the checkup. So next slide, please. Thank you. So what do we call by well child visits? So the well child visits are visits that are set up at different ages with the aim of detecting diseases and developmental difficulties at early stage, so that early management can be done. Also to ensure vaccinations. An important component of the well child visits is about counseling, as was already mentioned, on different aspects like healthy development, diet, physical activity, and injury prevention. And another important part of the well child visits is about monitoring growth. We'll go through that, but also about preventing and recognizing child maltreatment, about building trustworthy relationships between the families and the healthcare providers. And this gives a good opportunity to answer any questions related to the health of the children that any caregivers can have, and even the children and adolescents. And it also gives the opportunity for good coordination support with the community health services. Next slide, please.
So we would like to know from you, how many well child visits? So, and we would this goes a little bit beyond the early childhood development, but how many visits are the norm in your country? How often does a child between 0 and 18 years go for a checkup or a well child visit in your country? You can just enter a number, click a number, enter a number. Again, we will give 30 seconds for people to give an answer to that. There's no right or wrong here. We're just curious to learn about the situation across all the variety of countries that is represented in our audience. Okay, I think can somebody read? You have to go to. Okay, somebody's already replying in the chat. To join the polling, navigate to menti.com and enter the code on the top of the page. Okay, I think we will stop that question now. So as you can see, there's a really large variety. Some countries have only 2 visits, and I think the country with the highest number of well child visits and screening visits across our region is the country with 148 visits from the child going to a healthcare provider between 0 and 18. So with this to say, there is not a lot of evidence on which is the exact right number. However, next slide, please. We reviewed all information that was there. We, as in the guideline development group, the editorial group of the pocketbook, reviewed what countries were doing, what the evidence said, and then came up with the recommendation of these 14 visits of well child visits. You can see here the spacing. And with this, I hand over back to Sophie.
So these 14 well child visits will support, each of them, the pocketbook will support the primary healthcare provider with structured guidance. And so we said, so we'll come back with Sarah. So Sarah is 6 months old. So next slide, please. So by knowing the age of the child, we just go to the corresponding well child visit. And so you will have, so we don't expect you to read the description on the right, but it's to give you a vision on how it looks like. So the content there is about, so we start with some remarks, so with some box about important things not to forget as reminders. And then the structure of the well child visit is to start with history. So there will be some highlights of important features to go through depending of the age of the child, then to be continued with examination. So in the examination, obviously with the start of the growth monitoring, and we'll go through that in a minute. And also by system, same like important features to pay attention to depending on the age of the child. And then you will see lots of pages for cross-references so that if there is any normality or anything we need to go deeper in this area, we have the cross-reference to go to the corresponding area in the pocketbook. Then after the examination, we'll have, within the examination, we'll have explanation on how to assess the developmental milestone. We'll also go through that in a minute. And we'll continue with counseling on important features and vaccinations. And then the important last point, which is when are we going to see Sarah next? So next slide, please. So after conducting the history, asking Sarah's caregivers on important aspects on how she's feeding and how is going at home, we'll measure Sarah's growth, because this is an essential part of the well child visit. So in this chapter, in chapter 3, we'll provide clear guidance on how to measure the length or the height of the child depending on the age, and then the head circumference and the weight. And next slide, please. Then with the measurements, if you go to the annex, we'll have all the growth charts for boys, girls, with the different weight for age, length or height for age, etc., with guidance as well to help the healthcare providers to plot these measurements on the growth charts. And then depending on the reading of the growth charts, we have table to tell the nutritional status of the child. So for example, we see that Sarah, depending on her age, being a girl with weight and height, she may be either malnourished or well-nourished, excuse me. And then you will have a cross-reference to go to the pocketbook for the further management. Next slide, please. So another area where the pocketbook will provide good support during the well child visit is about the assessment of the developmental domains. So you all know, or you may know, the different developmental domains about the language, the movements, and others. And so for the different ages, we will have the milestones. So what do we expect from Sarah at 6 months of age? And so you will have that in tables for good references. And again, depending on what you will find on SARA's examination, when you assess the milestone, you may have like different cross-references to jump from one chapter to another to know what to do next. Next slide, please. So we know what is going on with SARA, about the history, we know about the examinations. What is next? So what is next? We need to counsel the parents and the caregivers. We already mentioned several times that counseling is a very important part of the well-child visits. So this is a good opportunity. So we'll have for each of the well-child visits, depending on the age of the child, this structured way on the different part of counseling. So regarding feeding, nutrition, and the different vitamin supplements, regarding oral hygiene, regarding prevention, for example, on the sudden and infant death syndrome, about the physical activity, the time of good quality sleep, as mentioned already, about sun protection, injury prevention, and also about how to support early childhood development with the cross-references to the different chapters. And this is where we jump to chapter 4. Next slide, please. So just to recap, so in this chapter 3, we'll have all these well-child visits according to the age. And then in chapter 4, this is a big focus on the health promotion and the disease prevention. So this is where we'll refer to when we have any anything that went out of the, anything that we need to, excuse me, these are will go as a cross-reference from chapter 3 or from any other chapter. So we have more information, deeper information on each of the topics that you can see here in this slide. Next slide, please. So early childhood development. So here we'll start by assessing how to, by assessing the risk factors for developmental difficulties related to psychosocial and environmental risk factors, health-related risk factors, so that the healthcare worker can go through them and assess the family of SARA. Next slide, please. Here you will have, again, guidance, as we mentioned about the milestones. So by age, you will see which are the milestones that we can expect from a child who is coming to your healthcare facility. Next slide, please. And then after assessing that, here we provide more information on how to provide information on promoting and supporting the early childhood development. And we have counseling messages. So, and again, it's a bit small to read, but this is not for you to read, but it's about to explain you that we have, so next slide, please, that we have visual features through all the pocketbook. And many of these counseling boxes are in these chapters. So these are counseling boxes that, with lots of information directly directed to the parents, to the caregivers, and sometimes to the children and adolescents, depending on the age, so that it provides helpful guidance so that you don't forget important messages to provide them. In the pocketbook, also throughout all the chapters, we have visual features, as you can see on the left, which are dedicated and addressed to the primary healthcare providers. So we have boxes with messages as reminders. We also have we have red flags for important informations, and do not. So do not messages as well as reminders so that this information is not missed. So for example, do not give higher doses than the recommended 400 international units for vitamin D, as they do not added benefits and can be associated with toxicity. Next slide, please. This is also to show you that throughout the pocketbook, we have over 100 illustrations so that it's user-friendly, and it illustrates so that there's not only text, but it illustrates messages for the doctors, nurses, and the families. Next slide, please. So we already show you an annex with the growth charts. There are other annexes. So for example, this one with the practical procedures, which gives detailed information on, for example, measuring the bilirubin with a transcutaneous bilirubinometer, how to give injections, and more. Next slide, please. So going back to SARA in chapter 4, so we already went through the guidance for the early childhood development. We'll have also detailed guidance if we need, if the private healthcare provider needs through vaccinations, about screening tests and monitoring, about nutritional counseling, which is an important aspect of the well-child visits. So now we want to hear from you. Please tell us. Next slide, please.
So in the WHO European region, what is the percentage of babies that are exclusively breastfed for the first 6 months? You know, this is a very important recommendation. We know there's lots of benefits to it, and we would like to know, is it 30%, 45%, or 60% of all children that are exclusively breastfed at 6 months? 45% is in the lead, closely followed by 30, overtaken now by 30. Voting is continuing. 30 is now clearly in the lead. Ten more seconds for those who wish to vote. Go to Mentimeter, insert the code, and answer the question. Somebody says 40%. Yeah, it's a trick question. That's the answer we didn't give you as possibility. Okay, so the majority says 30%, closely followed by 45%, and the few optimists who say 60%. Somebody says 50. No, I promise one of these answers is correct. Okay, 69 people voted. Next slide, please. The answer is actually 32%. Only 32% of infants are exclusively breastfed for 6 months. And again, we have a very, very large variation across the region, with some countries doing much worse than others, as you can see here on the slide. We are actually, yes, somebody says in Rwanda, it's 86% breastfeeding rate. Yes, WHO European region is the worst region of the entire world. We are doing extremely poor in breastfeeding. So I think that's, again, a role that the primary health care provider can play to counsel and support mothers to continue breastfeeding. Thank you for playing. Next slide, please. So this is how the pocketbook can help with this. It has included age-appropriate nutritional counseling and feeding recommendations, information on promotion and support of breastfeeding, how to assess the breastfeed, and how to overcome common difficulties with breastfeeding. We also have information then around 6 months when complementary feeding should be introduced. We have information for to counsel parents and caregivers on the healthy diet, on what food and micronutrients are needed or not needed. Again, we have a long list of do nots also in that chapter. Next slide, please. Sophie is going to introduce Yusuf to you.
So I cite also Sarah now is good. She's back home, and Yusuf is coming to your clinic. But Yusuf is coming, he didn't have an appointment to come, but he's just coming because the parents referred that he's not, I mean, compared to his sister at the same age, there's a delay in speaking, there's no words coming out of his mouth, and they are a bit worried. So how is the pocketbook going to support you with that? Because it's not a well-child visit, so you will not probably enter the pocketbook in chapter 3. Next slide, please. So the chapter 6 is a child presenting with a specific complaint or symptoms. So we have a list of the most common or relevant symptoms or complaints. So for example, for the case of Yusuf, we may go to difficulties with social interaction or communication. And so here in this chapter, again, you will have structured information on history, examination, managements, and indicators for urgent or for referral, what to do next. You will find tables for different child diagnoses related obviously to this leading complaint or symptom. So for example, for Yusuf, we'll have to go through that and see what is relevant according to the examination. You will see that at least for these specific complaints, you will be brought to assess the developmental milestones, probably to also go to the growth monitoring, etc. So all that will be structured also in this chapter. Next slide, please. So once in a few weeks, so in a few months, while you may have already a disease or condition for Yusuf, if it's one of those that you can see on the screen. So for example, do you have developmental difficulties, information on autism, ADHD, Down syndrome, neurological defects, fetal growth spectrum disorders. So in this chapter, the entry point is already for the specific disease. So the pocketbook will support the primary healthcare provider with information on these diseases or conditions and how to manage them and what to do next to reach the full potential of the children with this disease and conditions. Next slide, please. So this is the last slide to give you a brief overview of the content of the pocketbook. So there are other annexes, and this is one that we wanted to share with you, which is linked mainly with chapter 6 and chapter 7. So any drugs that is mentioned in the pocketbook will be gathered in this annex, which is in yellow pages, so that it can be found very easily. So you will find all the drugs in alphabetical orders, and we'll have also some emergency drugs in the book flap of the pocketbook. Next slide, please.
So just to close by reiterating, I think we said most of this already, but just to give you a short outlook, we have already published Russian and Ukrainian language version, Romanian, Greek, Armenian, and Italian translations are underway. We very much encourage country-specific adaptations that might be required to suit specific circumstances. And as already said by Joao, WHO stands ready to support as much as we can the adaptation and translation processes in the countries who wish to start this undertaking. Also mentioned already, we're developing an app because so we can offer the book also on the mobile phone. And the last point is that we're also developing a training course for primary healthcare providers based on the pocketbook. With this last slide, please. Thank you all. Please reach out if any questions or comments, and I hand back to Martin. And thank you all for playing along.
Well, thank you very much, Susanne and Sophie, for this presentation, which was obviously a quick gallop through the content without the intention of giving you all the detail. It only should give you a flavor of what is in the pocketbook. As Susanne was saying, the adaptation is a process which is something needed in countries. Sergei will speak about the Armenian example afterwards a little bit more, and you should not see this as a one-off, the adaptation. It is in the context of reviewing your early childhood development guidelines, because obviously you want to adapt the pocketbook to the circumstances in your country, but at the same time, you might want to adapt your circumstances in your country to the pocketbook, because these are evidence-based guidelines. So if you have something in place which is widely different from what's there, you might want to start a dialogue to see what needs to be changed, the book or the circumstances which you are dealing with. So Sergei will talk a little bit more about this afterwards. I said we have monitored the chat, and I would like to ask my colleague Aygul, who is more multilingual than I am in this regard, to come up whether there's anything which is cross-cutting as a question coming from the audience, which they would like to pose to Susanne or Sophie. Aigul. Aigul has her particular language skills on the Russian side. If there is something,
thank you.
Yeah.
Yes, Martin, thank you. We have several questions in English, primarily refer to the translation this document into national languages, for example, Croatian. We also have several questions regarding whether this pocketbook also has content which is relevant to program managers for monitoring the program. But this is, we know that this is compilation of WHO clinical guidelines, and if primarily focused for use by primary healthcare providers. We don't have any other language, questions in Russian. Yeah, maybe I can pick up also another question.
Please.
If CDC has growth charts for children with Down syndrome, will you please mention if it's also included in the pocketbook as annex? Maybe Sophie or Susanne can also answer this question. Yeah, probably.
Okay, thanks, Aigul. Any response from Sophie or Susanne? And then I would prepare yourself, Alex, or whoever is monitoring the Serbian, Croat, Montenegrin, Bosnian language versions, whether there's anything there coming up.
So
Yes, I will just briefly reflect on the languages, and so as said, we would very much value and try as much as possible to support as many translations and local adaptations as possible. Please reach out to the office. For everyone, this is the answer. We do not have information for program managers, as Aigul already said. This is clearly specifically photos and clinical primary healthcare workers. There was one question about that Italy didn't have data on the map. They just did not answer the question. So we didn't know, there was just no answer to our question. So it didn't say anything about yes or no of having ECD services available. And there was also one question about making diagnoses. So for autism, for example, the pocketbook does recommend collaboration with the specialists. So we wouldn't expect the primary healthcare provider to make some diagnoses. Yes, it's very clearly spelled out when it should be work together with the specialist and more taking a coordination role. For some things, they are encouraged to make the diagnosis in the book. I will stop here. Over to you, Sophie.
I think you have replied all the questions. Maybe the last one, if I don't forget anyone, is about the growth charts. So in the annexes, we had to choose the most common one so that it's the pocketbook still can fit on the pockets. So as a reply, no, we don't have the growth chart for children with Down syndrome within the annex, but we do refer to the websites for all these other growth charts that are not included physically in the annex. So you will have the link to refer to them. Back to you, Martin.
Well, thank you very much, Sophie and Susanne. Any more questions coming? Particularly,
just a quick
yes.
reaction.
Alex?
I see my colleagues are asking me already, many interested to support translation of the pocketbook in the international languages. Should they reach out to WHO national offices for this process, or to Suzanne or you? Who are the focal points?
Well, as usual, you keep the WHO country offices involved in the whole loop, but the support is a technical support, and therefore it needs to be done by the regional office. We have the files available in InDesign, which is the most common file which is used for publishing information. And as Susanne was saying, we are working on an app at the moment, again, which will be a generic app where you can then play around with the languages which are used in this. So please involve the country office, reach out to Susanne and Sophie as the main focal points for this. Keep UNICEF involved as well, and we try to coordinate it, particularly if it's neighboring countries which have similar languages, and that we can keep it together. Just to say again, obviously this is a job aid which serves a very specific purpose, which has to fit into the wider health system. And therefore, we have presented it already in a previous webinar, our joint tool between UNICEF and WHO, which is building on the framework for early childhood development to do a situation analysis in the country, what's actually in place, because we want to push the boundaries. We don't want to regress to the situation which might be not very promotive. On the other hand, when you saw the question about the number of well child visits, there seems to be some countries which only think that monitoring or screening is responding to all your needs. And of course, we want to promote with this pocketbook not screening for the sake of screening and labeling a child as being sick. We want to have developmental monitoring, which leads to a response pathway, which is then establishing a diagnosis as far as needed. And this is the referral pathway, and then providing support, linking children and parents up to support for addressing developmental difficulties. But I'm preaching to the converted. So obviously, we are having a very easy way in this. We just want to support us and each other in this whole process. I see a question just popping up about Asia Pacific Pocketbook. We are talking to our regional colleagues in other regions to use it. As far as the content which is in it, we obviously had to make a choice not to make it even thicker. And therefore, for example, there's nothing in it about malaria and malaria prevention, or dengue and dengue prevention. That might be contents which might be needed for other regions, which we did not include in the European region because we didn't consider it so important. So with this, I think we have to close this group of questions. Susanne wants to respond quickly to something.
I just want to say one thing which I think we haven't brought across enough. So this is not, we focus very much on identifying, but whatever you identify, there is a follow-up action in the pocketbook described. So it doesn't stop there, in case this wasn't clear. So there is, for each problem or concern you identify, there is a recommendation on what to do next, how to either ask the child to come back for more monitoring or link to services and early intervention. So this is all in there. Thank you. And we're happy, please reach out via the emails that are, I hope, in the presentation, or I'm sure that is. When you receive the recording, reach out to us. We are happy to support as much as we can. Thank you, Martin.
Yes. Thanks, Susanne, for this clarification. And obviously, just to say again, this is again a kick-off for the pocketbook. If you have specific questions, specific needs, please reach out to us afterwards, and then we can follow up. It will be an iterative process, and maybe in a year's time, we can share more experience with the use of the pocketbook in countries and how it fits into the health system, establishing a referral pathway. Time is running quickly. We have got 22 minutes left, and we would like to hear from countries about country experiences. For this, we have got 3 distinguished experts here, which are really going across the width of the region from southwest to northwest to southeast of the region. Our presenters are Dr. Sergei Sargsyan from Armenia, who is the advisor to the Minister of Health and Child Health and the head of the Institute for Child and Adolescent Health in Armenia, Arabkia. We have got Dr. Eileen Scott, who is the Public Health Intelligence Principal of Public Health Scotland, in Scotland, with a particular affinity to early childhood development. And we have got Mrs. Barbara Menezes, who is the coordinator of the National Program for Infant and Young Health and the assistant coordinator of the National Life Cycle Violence Prevention Program in Portugal. So each of them is going to give you a brief overview on issues of early childhood development and tries to relate it with some facet or aspect of the pocketbook where it might help or how it might need adaptation. Thanks to all of you for joining us today and sharing your country experiences. And let's start in the Southeast with Sergei Sargsyan from Armenia. Sergei, please.
Hello, dear colleagues. I'm glad to greet you and thank for this opportunity to share experience. To move forward, I would like to start with some flashbacks. So what about pocketbook? Because pocketbook is a product, is also, I would say, son or grandson of WHO, some other books. Yeah, starting, for instance, module on the management of respiratory infections or diarrheal diseases, or further it's IMCI. So somehow we say that it's some kind of new generation of WHO products. As in the past, we worked with, based on, for instance, respiratory models, that mortality decreased 3 times after on IMCI, and mortality again decreased. So therefore, its products and our collaboration with WHO was really quite successful. And right now we have 3 times less mortality. But times changed and we changed with times. Yeah, and therefore our pediatrics changed. Child health care needs change. And among these needs is important change is introduction of, is bringing child development on high agenda. And of course, I have to tell you that we started working on this agenda quite early in the late 90s. And again, with support of UNICEF. It was the first time when with UNICEF, with colleagues from the States, we started working on developmental monitoring models. And after that, with UNICEF, we implemented early intervention concept. And assessed, by the way, assessed needs of developmental support as much as 11%. It was a very big household survey. Later, we started working on different child developmental services and intersectoral services. I'm very glad to say that Regional Director of UNICEF, Ms. Afshan Khan, was in our places, and together with UNICEF, and these models also were recognized as successful. And so we continue on time change. We are coming to a new agenda. We are coming to the new concept of early intervention. And in this regard, this pocketbook and those ideas and concept and those practical recommendations, which are in now in this our new edition, will be helpful. I will say that we consider as child development, developmental monitoring, nurturing care, habilitation, rehabilitation in integrated manner. And in this integrated manner, this pocketbook, which incorporate all these components, and further adaptation. Of course, we need adaptation. We believe also will be helpful. No, of course, I have to tell you that we have a bit even more. That just was a question about autism. So chat is incorporated. Question was about Down syndrome, this management charts also are incorporated. So we have to work on that. And I believe that work in our context will be useful not for ourselves, but for other countries of the region with same settings. So thank you for this opportunity, and I believe that further work on that will be successful and will be useful for the children of our region. I truly believe in that. Thank you.
Thank you very much, Sergei, for these reflections. And it was mentioned before already, you are on the big task of adapting it at the moment already to Armenian, with the challenge that Armenian language is longer than the English language. So the size will actually increase. And I saw a question in the chat again about the electronic digital version. For some of these issues, the digital version obviously makes life much easier afterwards. With this, I would like to move to the Northwest and hand over to Eileen Scott for her reflections. Eileen, please.
Thank you so much, Martin. I'd just like to start by saying how much I welcome the publication of the pocketbook and its efforts to encourage consistent, evidence-informed assessment, monitoring and intervention in early childhood development, because it's such a critical period of life, as we all agree, for getting things right, not just for now, for currently children's lives, but also for the public health of our nations going forward. I'm going to talk to you a bit about today our experience of the pandemic and what we know about the severe shock to our health systems and to the impact on early childhood development, and link that to the power of things like the pocketbook for enabling us to monitor and take action where we identify that there are such impacts on child health. In Scotland, I have popped into the chat so you can look at these charts. Chat 5 shows you that in Scotland we have seen a sustained and elevated impact in terms of early childhood development concerns that started to emerge largely in January 2021. So we saw a significant increase in the percentage of our children who have had a recorded developmental concern. For example, for children aged 13 to 15 months, at our last point of recording in December 2022, we saw that around 14% of children at age 13 to 15 have one or more developmental concerns. So that represents a 5% increase from pre-pandemic levels. I'll come back to talk about a specific issue linked to the domains around this. But it, I think, talks to the importance of having a consistent programme of activity and your ability not just through that activity, but to monitor and report on that. So in Scotland, we have our health visitors who are specialist nurses who have a key public health role. We deliver a universal offer to all children under the age of 5 years. And that forms a core part of our child health programme. And rather reassuringly to me, because one of the things that the pocketbook does is that we can benchmark against it. So looking at what it is that we currently offer and how the pocketbook and what WHO are recommending connects to that. Are there any areas that we are currently missing or things that we should be strengthening? We offer 11 visits to children, and those focus reassuringly in keeping with the pocketbook around looking at health promotion and detecting physical, developmental or social risks at an early stage to facilitate early intervention. We monitor development milestones at 6 months, 1 year, 2 years and 3 years. And we have, of the health visiting pathway, we have 11 visits. We see our families 11 times. 8 of those are within the first year of life. And then we have the 3 child health reviews that I've mentioned at 13 months, and 27 to 30 months and 4 to 5 years. But critically, the findings of these are fed into our child health surveillance programme, which is why we know that we've seen this issue linked to the pandemic, because that programme both initiates the invitation of children and families for their reviews, but also they report, their health visitors report and record the impact or the consequences of those visits into that system. So as well as forming part of the child's clinical record, we use that at a national level to do statistical analysis and reporting, which has enabled us to identify that the pandemic has caused quite a significant impact in terms of children's speech and language concerns. If you look at the second plot, you will see that that rate has risen quite significantly along with gross motor concern. But that has also enabled us to work very closely with our colleagues in government and also our Royal College of Speech and Language Therapy to look at what this sort of significant increase in need means in terms of service provision and planning. So we have developed a protocol now looking at different mechanisms or ways in which we can offer to support for children and families across the country. on the basis of this. And I think that's one of the critical things about having consistent mechanisms for identifying early childhood development concerns, because whilst the potential for missing critical periods of development exists, there is also significant potential for us to pick up early childhood development concerns and intervene quickly for lifelong impact. So that was a quick whistle-stop tour of what we do in Scotland, but hopefully I think it brings a different flavour to the discussions today and the utility of the pocketbook.
Thank you very much, Eileen, for this insight, and particularly the insight about the worrying developments around COVID and how we want to use guidelines to address some of the shortcomings. Our last presenter is Barbara Menezes from Portugal. Barbara, the floor is yours.
Good morning, everyone. I greet my colleagues at the table and all the participants in the webinar. And I thank you for this opportunity to share experience. I was asked to talk a little about the impact of pandemic COVID-19 and the benefits of using the pocketbook in primary health care for children and adolescents. About the COVID impact, public health measures have been implemented in accordance with the various stages of preparation and response to epidemic situation in order to progressively decrease the transmission of the virus, provide adequate health care to all patients, and protect public health. We learned that the screening of newborn provide in the national neonatal screening program, maternal health and child and adolescent health surveillance consultation with evaluation of psychomotor development and compliance with the national vaccination program should not be postponed. The health surveillance of pregnant women is maintained and cannot be postponed within the scope of National Program for Child and Youth Health was created, guaranteeing the continuum of children's health surveillance, especially in primary health care, family health team, vaccination, local early intervention teams, support groups for children and youth at risk, adult violence prevention teams, through face-to-face contacts, all consultations that coincide with vaccination and are considered priority and urgent, or telecontacts. These interventions are especially relevant for young children who do not attend an educational establishment, the very young children. Faced with this challenge of continuing to the follow-up of children and their family, it was necessary to adapt the activities and procedures safeguarding safety, public health, and ensuring compliance with the fundamental principles of early intervention in early childhood. In this sense, the activity of the early intervention teams should not be interrupted. The children and their family continue to be accompanied with the use of new technologies, with particular attention to situations of greater social vulnerability, to which, whenever necessary and appropriate to the conditions experienced, a face-to-face follow-up was ensured. In line with the recommendation for the containment of the spread of COVID-19 pandemic, during the state of emergency and calamity situation, the face-to-face activities of the professional of local early intervention teams in primary care, healthcare were suspended, and the telework regime was adopted, carried out from the domicile of each professional in the period of mandatory confinement. Following the release plan and with the objective of ensuring the resumption of face-to-face activity by local intervention teams in a gradual and progressive way, we learned that specific guidelines should always be elaborated according to the pandemic stage, and the teams were acting and integrating the guidelines they were receiving. Most children and family were referred by the health sector, and there was a decrease in the number of references to the system of early child intervention, and expect that may be related to the situation, the COVID pandemic. In the area of literacy, pocketbook intervention area, several materials and products were developed to raise answers among families, caregivers, or children, and dependents and the community about life cycle preventing violence, not only during the COVID-19 phase, health relationships, social inequities, gender equality, child rights, stress and burnout, domestic violence and violence against children and youth, for dissemination on social networks. In Portugal, early child intervention is managed with the intervention of 3 ministries: health, social affairs, and education. We have 155 teams in the health primary care. And now, how can pocketbook help? So about the importance of having a pocketbook, I agree with all that Susan and Sophie presents. I can refer to the experience in Portugal due to the fact that we have a child and youth health program, and how the type of contents present in the pocketbook help to organize and improve the quality of the health surveillance of children in Portugal. It was a challenge to participate in the validation of the pocketbook, a very valuable tool that we hope to be able to translate and adapt to the reality of our country in the near future. The training course for primary care providers will be prepared based on the pocketbook with specialists in each of areas, like we do now with the the health program for children and adolescents. Support materials such as pamphlets and brochures will also be prepared, as well as promotional material on social networks. We are developing a children's health bulletin in digital format, so the application of the pocketbook will also be a net value for our target audience. The contents of the pocketbook will also be useful to complement the bulletin in production. I finish with a note about migrants and a situation that is a reality in Europe, and early identification of newborns and children residing in the country, namely immigrants whose parents do not yet have complete legalization and who are parts of the most vulnerable group. In Portugal, a user number for the National Health Service is assigned to all newborns before discharge from the maternity ward, even if they do not yet have the capacity to be registered in the civil registry as citizens, to identify all these children and not to leave behind. I thank all those present for their attention, and I wish you the continuation of the good work. Thank you.
Thank you very much, Barbara, for these observations, and thanks to all three panelists for bringing a country perspective into it. I think we have all suffered from COVID, and we must say we have particularly suffered in early childhood development because somehow infection control was considered more important than long-term early childhood development. And I hope that with this sort of process, we can at least address some of the shortfalls over the last years and hopefully avoid a similar sort of situation over the next years. We are coming to the end of our session. Unfortunately, we don't have time for another round anymore to reflect. We have taken note of lots of things in the chat, and there have been responses to the questions in the chat right away. You have the contact details of us, and you can reach out. We are looking forward, as I said earlier, to another follow-up session afterwards. Please particularly reach out if you would like to get into language translation and adaptation, because we are very interested in this. This initiative, the Health Systems for Early Childhood Development and the Knowledge Platform, is obviously providing a forum for this sort of exchange and sharing the materials which have been mentioned by several of our panelists and the previous presenters already. To close to today, you see already flashing up, brought up by Emily. The next upcoming webinar will be on the 6th of April for the regional launch of the Nurturing Care Practice Guide developed by WHO and UNICEF jointly. You can register via this QR code on the screen, or the link which we have put into the chat box. And with this, I want to thank all of our participants, all of our presenters today again. And I think we could show that promotion of early childhood development is an issue which concerns all of us. And it's a good example of good collaboration with my colleagues in UNICEF and ISA and all of you. Thank you very much with this, and have a good day.